Person-centered practice for the nurse with a growth mindset. Person-centered care is a philosophy that values individuals' own unique values, personality, personal history, and the right of each person to respect dignity and to participate fully in their life choices. McCormack and McCants. Person-centered care, in line with McCormack and McCants' philosophy, is all about active patient engagement, the concept of self as a human being in relation to the world around them, and the sense of self awarded by others. McCormack first spawned person-centeredness as having four modes of being in relation, the beneficial relationships through patient and nurse interactions, being in social world, patients within their social group and amongst their support network, being in place, how patients' physical space relates to their experience, being in self, the concept of respect and recognition as a human being, not just a patient. This includes respect for their beliefs, values, and their ability to make decisions and perform activities for themselves. These modes led McCormack and McCants to the development of person-centered care in nursing and later resulted in the development of the person-centered practice framework. The person-centered practice framework was first developed and used in research to see the effects of person-centered care in nursing. After 10 years of empirical evidence-based research and development, the person-centered practice framework is now actively implemented in nursing practice. The framework, as shown here, is made up of four main levels: prerequisites, a focus on nurse characteristics; the care environment, a focus on nursing care within the clinical environment; person-centered processes, a focus on activities involved in delivering nursing care; expected outcomes, a focus on results of successfully delivered care. Today, we are going to look more in depth into the care environment level of the framework.
The care environment element of the person-centered practice framework focuses on the context in which care is delivered to the patient by looking at a number of different elements. These elements include an appropriate skill mix, shared decision-making, effective staff relationships, supportive organisational systems, power sharing, the potential for innovation and risk-taking, and the physical environment. In Bucket and Kalman 2005, they refer to skill mix as a relatively broad term which can refer to the mix of staff in the workforce or the demarcation of roles and activities among different categories of staff. There are a lot of factors taken into consideration when deciding on appropriate skill mix as healthcare organisations work to provide the most cost-effective and efficient services to patients. This increase in health workforce redesign is driven by staff shortages, cost containment, and organisational interface facilitation. Elwin et al. 2012 best describes shared decision-making as an approach where clinicians and patients share the best available evidence when faced with the task of making decisions, and where patients are supported to consider options to achieve informed preferences. To enable shared decision-making between healthcare professionals and patients, an effective team is necessary. Effective staff relationships are interpersonal connections that are productive in the achievement of holistic person-centered care. The way in which staff interact with each other can have an impact, whether direct or indirect, on the experience of the patient and their family during the stay in the healthcare facility.
There are many instances of unpredictability that can alter the way a shift is managed. Nurses are taught that at the start of every shift they should plan out their day. However, a plan can often be thrown into disarray. Nurses can become so busy that they don't have time to truly connect with their patients and check to make sure they feel safe and comfortable. In a supportive organisational system, when writing out their duties for the day, nurses can schedule in time on their plan to chat with patients that they need to. This helps promote person-centered care and can improve a patient's outcome by increasing their morale and feeling as though they have been heard. Despite the assumption that doctors are in charge in a hospital, it is more often the nursing staff that have the most power on a ward when it directly relates to person-centered care. During a standard shift on the ward, the power dynamic between the nurses on shift can change rapidly. Whether it be the nurse unit manager, the RN in charge of the ward, a nurse with more experience with a certain patient, the nurse that takes charge during a code, or even the patient themselves, the power sharing during a shift will change depending on circumstance. However, no matter what the power dynamic is during any one particular shift, the nurses will always strive towards patient empowerment for the best possible person-centered care. One of the great innovators in nursing history is Florence Nightingale. Even though many aspects of nursing have since changed, she is still renowned as the first to take the leap in nursing. Nurses have the opportunity when caring for their patients to be innovative and take certain risks that may improve the quality of the patient's care. This may even be doing just small things to help their mental health and well-being during their stay in hospital. Examples include suggesting a patient talk to a professional in the hospital about what is happening at home, or even just adding a personalised touch to their room or bed bay to brighten their day. These types of actions are not generally considered risky, but can backfire depending on the type of patient, their particular mood and situation. The physical environment in nursing is always changing to adapt to the advancements continually being made throughout the field. There are also many differences within different wards or bed bays based on the patient's needs. With these differences, nurses are required to adapt and continually change. The physical environment also affects the person-centered care within the ward and will likely change as the patient's condition changes. For example, as a geriatric patient who was admitted to hospital due to a fall regains their strength, it is likely to see different mobility aids close to their bed should they need them.
Nursing is a dynamic and challenging profession, requiring engaging and inspiring role models and leaders. In today's ever-changing and demanding healthcare environment, identifying and developing nurse leaders is one of the greatest challenges faced by the nursing profession. There are many qualities to what makes a good nurse. However, our end goal is always our patient, and this is when person-centered care comes into place and is identified to lead the team successfully. There are many key leadership theories. These include the great man theory. This theory believes that the ability to lead is inherent. The trait theory, which is similar to the great man theory, however focuses more on psychological attributes such as appearance. The contingency theory highlights different variables in certain settings that determine the best suited leadership for that situation. The situational theory, which is very much similar to the contingency theory and the behaviour theory, that focuses on the specific actions of leaders rather than their traits. With leadership in nursing comes many challenges. These challenges can be due to staff shortages, long working hours, budget and financial issues, and meeting patient expectations. When nurses are hearing that their patients are unhappy with the care they are receiving, this can affect staff morale and put nurses under a lot of negative stress. Meeting patient expectations is hard enough as it is, and some people fear it may worsen as the healthcare and the elderly population increases.
Innovation and initiative in healthcare. Initiative and person-centered practice. The healthcare environment is always changing and improving to enhance person-centered care. One initiative to increase patient involvement is My Health Record Storage Technique. This simple yet effective technique of storing valuable information regarding a person's medical history has already been shown to enhance patient communication and proactive action. Current in healthcare. There has been a push to encourage a more nurses to patient ratio throughout hospitals. Research has been conducted and conclusively demonstrates that the larger the number of nurses to one patient, the higher the mortality rate is. Future innovation in healthcare. This healthcare innovation explores the results of assigning more nursing to a patient and directly links the results to person-centered care. Nurses can further contribute to the innovation by using their communication and shared scope to give better person-centered care to all patients. My Healthcare electronic storage system has successfully influenced person-centered care through allowing more patient involvement throughout the entire process. This unique electronic storage system allows patients to download their own medical information, including blood tests, notes taken upon observation, and other noteworthy subjects. This process encourages the patient to become proactive regarding their medical history and knowledgeable about their situation. Sometimes I inspire my patients. More often, they inspire me.